Hello, today we will be discussing the use of health promotion strategies for the increased consumption of fruits and vegetables. Our team members include Taisha, Caroline, Lauren Christopher, and Michelle Holt. The Center for Disease Control and the World Health Organization have recognized the overall increase of morbidity and mortality rates for cardiovascular disease and stroke. These two afflictions have become the leading cause of death not only in the United States, but the entire world. Two of the preventative and diagnostic interventions that can be used to prevent the onset of these diseases are increased fruit and vegetable consumption and physical activity. Pizza and colleagues have found that 1 in 3 Americans are not obtaining the proper amount of fruits and vegetables per day. The CDC recommends at least 5 servings of fruits and vegetables per day. Furthermore, Gunther and colleagues have further analyzed the types of fruits and vegetables that would be most preventative against cardiovascular disease and stroke, which include fresh fruits and vegetables with secondary options, including canned, dried, and frozen, dark green vegetables, beans, and peas, for they were the lowest in intake but contain essential nutrients and minerals. And lastly, increased fruit intake would allow for an increased consumption of antioxidants, which not only prevents inflammation but also maintains fat cell regulation. In order for health professionals to translate these recommendations to practice, they must design effective health campaigns that will convince consumers to increase their fruit and vegetable intake. For the remainder of my section, I will discuss how health campaigns are designed within the ecological framework and are then organized pertaining to public health theory. We'll then apply this knowledge to 3 examples of public health campaigns that highlight an excellent, average, and poor execution of a public health campaign. Public health campaigns are designed within the ecological model presented at the Ottowa chapter in the late 90s. The ecological model is the assumption that to change a behavior, a health campaign must acknowledge that the behavior is affected by the environment on the 1. Interpersonal level, which includes individual attitudes and beliefs, 2. The relationship level, which includes close relationships with friends and family, 3. The community level, which includes work, school, neighborhood, and level impact, and lastly 4. Societal level, which includes beliefs and ideas upheld by laws, culture, and societal norms. Effective campaigns will focus on multiple levels of the ecological model that are more distal, so pertaining to individual and relationships, rather than proximate, such as societal and community, to the individual behavior. Within the level of ecology that is focused on, successful campaigns will incorporate health promotion strategies. These strategies are the general categories in which professionals promote health, which is regarded by the Ottowa chapter as the process of enabling people to increase control over and to improve their health. These strategies include community capacity building, research, policy development, advocacy, social marketing, health education, program development, and evaluation. The 3 campaigns that we'll present were developed within this framework in mind, but also within the following theoretical construct. We'll now hear from Tisha Caroline concerning the health belief model.
The health belief model has several constructs and can be used to assess an individual's willingness to adopt a health behavior. The health belief model can be used to address fruit and vegetable consumption. Perceived susceptibility is a targeted theoretical construct in this campaign, primarily through information that shows that most Americans are not receiving their daily requirement of fruits and vegetables. According to the article, the United States dietary guidelines recommend increasing fruit and vegetable intake to reduce the risk of chronic disease such as heart disease and stroke. For perceived severity, the campaigns focus on how severe the diseases are and highlights that they are the leading causes of death in the United States. The perceived benefits of engaging in the behavior, eating fruits and vegetables, will prevent these chronic diseases from happening. Furthermore, there are short-term perceived benefits that will be highlighted, such as weight loss and a strong immune system. Perceived barriers can be access to nutritious food, the cost of food, and knowledge of different types of fruits and vegetables. In this presentation, we will discuss 3 campaigns and rate them as excellent, average, and poor. Our target audience is children and adults, 18 years or older for adults. Our 3 campaigns that we will be discussing are Take Me With You, Fruits and Veggies, More Matters, and 5 a Day.
In the next slides, we will look at the 3 campaigns more in depth. Here we will look at the HBM constructs that were used, analyze their social marketing elements, and rank each campaign accordingly. The Take Me With You campaign was launched by the City of New York government for the NYC community. The campaign identifies and highlights affordable fresh fruits and vegetables that require minimal prep. The HBM concepts include self-efficacy. There is a GPS-enabled texting program that equips smartphone users to find a nearby farmer's market. Modifying factors. Social determinants or perceived barriers such as time, the cost of produce, and socioeconomic status are addressed in this campaign. The farmers markets partner with Supplemental Nutrition Assistance Program, SNAP, and will give coupons to buy produce for every $5 spent using SNAP at the farmers market. The aim is to provide equitable access to fruits and vegetables for all. This is considered an excellent campaign due to its incorporation of social marketing. The 4 elements of social marketing, including product, price, place, and promotion, can be identified in the Take Me With You campaign. The product is fruits and vegetables. Social determinants such as socioeconomic status are applied to pricing options to address affordability. Places highlighted include farmers markets throughout NYC, and the promotion is multimodal, including ads run on subways, buses, and billboards. The CDC's Fruit and Veggies More Matters campaign was launched in 2007. The campaign is a health initiative focused on helping Americans increase fruit and vegetable consumption for better health and to reduce risk of chronic heart disease and stroke. The HBM concepts include self-efficacy. Self-efficacy will hypothetically increase through individuals having gained knowledge from this campaign about the benefits of fruits and vegetables in their diet. Modifying factors. Accessibility to nutritious food, the cost of food, and knowledge of different types. These are relevant to the campaign, but they are not all directly addressed. Cues to action. The campaign itself. The interactive web-based games for kids that were available on the CDC's website. This is an average campaign because it doesn't offer specific resources or locations to access produce and fails to address socioeconomic barriers by not including helpful information of food assistance aid programs in its promotion. Social marketing elements are addressed in this campaign. The product pertains to fruits and vegetables, and the place applies to the United States through the online campaign, and is therefore accessible to anywhere in the world. The 5 a Day campaign was launched by the UK government to encourage individuals to increase their consumption of fruits and vegetables to at least 5 portions to mitigate the risks of cancer, cardiac diseases, and diabetes. The HBM concepts include modifying factors. A modifying factor is socioeconomic status. Scholarly research has shown criticism towards this campaign for not addressing this modifying factor. This is considered a poor campaign As aforementioned, the campaign does not address socioeconomic status as a social determinant, and other research has shown that this campaign did not increase individuals' consumption of fruit beyond a fraction of a serving. Social marketing is utilized, the product is fruit and vegetables, and its consumption within the UK. The promotion of fruit and vegetable consumption has come as a multimedia communications campaign and in the form of collaboration with public and private partners. In conclusion, models in public health can help professionals design campaigns based on philosophies. Thank you so much for listening to our presentation.